You're listening to the Jōrni Podcast. How does the body's attempt to protect us from pain actually end up locking us in it? Find out in today's groundbreaking episode. Hi, I'm Petra Brunbauer. What if everything we've been told about holistic health, healing, and well-being is only part of the story? Because thriving in today's world looks different than it used to. Here, we challenge the narratives, rethink what it means to become human, and explore how that shapes the way we lead, live, and step into our full potential. This is the Jōrni Podcast. Welcome to today's episode. Pain is often treated as a problem that lives exactly where it hurts. In practice, when we are dealing with chronic pain, the place we feel it is not always the place where the real issue actually begins in the body. Eileen Kopsaftis is a pain consultant, movement expert, and nutrition educator with 30 plus years of experience helping people resolve chronic pain and maintain real-life function as they age. She is a licensed physical therapist with advanced training in functional movement and nutrition, and the author of 2 international bestsellers, Pain Culprits and Aging Culprits. Her mission is simple: replace fear and decline with truth, strength, and independence. Here is my interview with Eileen Kopsaftis. Hi, Eileen. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you, and probably not because the topic is so fantastic, because we'll be talking about chronic pain, but because it is so needed, I feel, in today's world, and such a good time to bring this out into the world, keep sharing, keep shining a light on it. I feel so many people are impacted by that. So thank you for being here today, and welcome to the podcast.
Yes, thank you so much for having me. I really look forward to sharing things that I really hope will improve people's lives as they hear this information, because a lot of it, as we discussed earlier, is not well known, but it really needs to be. So I'm very excited to be here. Thank you.
Yeah, absolutely. My pleasure. And I feel that you're completely right on the money. I think there's so many things out there that can help us with chronic pain. And unfortunately, you can't find them in one place, or not very well promoted or even talked about. So I'm glad that you're here today to share that. And for starters, would you like to share a little bit about yourself and maybe your journey or parts of your story that you feel connect to what you do today, and also share with our listeners what it is that you do today?
Yes, I think it's just in my DNA. Ever since I was little, I always gravitated toward what you call the underdog, the person who struggled, the person who suffered. I would see pain and I would want to fix it. It's my DNA. I don't know how else to explain it. And pain comes in more forms than physical. It can be emotional, it can be mental. And I actually have led a support group for women who've experienced abuse, and I've done that for 26 years. And part of that is because I did grow up in an environment similar to what a lot of people experience that is less than optimal. However, I have a very full life, and none of my past impacts my present or my future, except for the fact that I can say I'm actually very thankful for the life that I've had, because it has shaped me into who I am. And I think I can resonate and connect and understand people who are maybe still in that place or come from that place. I kind of joke when I'm in the support group, and I'll tell the women, if I had some perfect life growing up, I'd probably be some empty-headed little twit who couldn't connect with anybody. I think it's important, but our past doesn't define us. And if people are really struggling in pain, sometimes physical pain is a result of emotional pain or mental pain because of the nervous system mode that it puts people in. Trained as a physical therapist, I wanted to be a doctor when I was little, but I didn't really agree with the medical model. At least in my country, the medical model is treating symptoms with manipulation, with medications, procedures, surgeries. And it sort of isolates and puts people into boxes of you're a knee that walks in the door, or you're a shoulder, or you're a liver or a kidney. And that's not true. We are whole people. I love the term gestalt because it means we're more than the sum of our parts. And I think we need to be seen that way. And so I chose not to go into the field of medicine. I was going to go into the field of nutrition, but when I got the catalog from the college that offered that degree in my area, I disagreed with most of what they were teaching. And I knew I'd fail. They're not going to pass you if you argue with them. And so I saw the PT program, and I've always been fascinated by the human body. And I knew that that would give me the opportunity to spend time with people, to hear their stories, to be able to understand where their pain is coming from. And I've never really practiced in the conventional way because I was exposed to some amazing people who were extremely effective at resolving pain using specific manual techniques. They had a waiting list. Doctors would send people to them specifically. And one particular person I reached out to and said, please, will you share with me what courses I need to take that's going to help people, and what courses do I need to ignore so I'm not wasting my time and resources? And she and I quickly became friends. She was my mentor for years. We traveled together and took lots of coursework. But the more techniques that I learned, the more people I could help. And what I loved about it most was it taught me that the person is whole. And very often when someone has pain, the problem is not where the pain is being experienced. And I learned that right out of the gate. So I practiced very differently. If somebody had pain in their shoulder, it was almost always because there was something going on in their low back or their trunk. And I knew where to look and how to do this. But there's only one of me, only so many hours in the day. And I also came across the most fabulous training in movement that I considered the holy grail of movement. It was developed by the Gray Institute, Dr. Gary Gray. He's actually nicknamed the father of function. And they only teach professionals, movement professionals, healthcare licensed people. And I started teaching this in the clinic setting and saw phenomenal results. And then I started teaching it in community ed classes at the local college and saw whole classes resolve pain because they learned how to move and restore function in major areas of the body that weren't working, and nobody knew it because nobody was looking for it. And so that was just okay. And so I created online courses. I have my YouTube channel. I have done my best to find every megaphone I can get on, including this show, so people can learn this stuff. And so now I'm literally teaching people how to fix themselves. And there are some other strategies that I've learned that they can benefit from. But for the most part, understanding how the human body's created, how everything's connected to everything else. You're not a body part that walks through the door. And if someone sees you that way, they're going to be limited in how much they can help you. I call it the number one reason pain doesn't go away is because we're not addressing the cause. We're treating the symptoms. And that's my passion, to erase pain from the world. So that's kind of my story.
I love it. Thank you for sharing that. And of course, we come from places, usually as practitioners, of a lot of lived experience, which has shown us the necessity of the things that weren't there when we were going through these experiences. And we want to make sure that they are there for other people. I know that your journey probably wasn't the easiest and fastest journey through all of this, but thank you for sharing that, taking your lived experience and actually offering that to others so they can have less pain and feel better. And that, of course, is a big part of what you do as a practitioner, is integrate what you're living and experiencing to do that.
One thing I left out was the fact that I really was swimming upstream in my profession, because the challenge that you face when you don't stay in the box and do what's expected of you, I really faced a lot of adversity in order to fix people, because I was told, oh, if they come in with a neck problem, you can't treat their back. And I'm just looking at them and saying, well, the spine is one piece of anatomy. I know we broke it up into neck, trunk, low back, and pelvis, but it's one piece of anatomy. How can I not look at the bottom of that piece that may be impacting the top of that piece? Didn't you take anatomy in school? But I got so much pushback, and I literally was going to leave my job and go someplace that would allow me to treat the way I knew worked. I was also being very much pressured to see 2, 3, 4 people per hour. And it was interesting. I stood my guns and I said, no, I can't help people that way. I can only see one-on-one, face-to-face. I need a minimum of 30 minutes and an hour for an evaluation. And no, I won't treat that way. And I almost lost my job because of that. But the interesting part is there was another therapist. She was a PTA, an assistant, and she was keeping track of cancellations. And she found that the people who were double and triple and quadruple booking had the highest level of cancellations and brought in the least revenue. It always comes down to the money. And she found that I had the least number of cancellations and was bringing in the most revenue. So they left me alone.
Why does that story not surprise me? I think that's the saddest part about it all, is that as alternative and holistic and complementary practitioners, there's a lot of pushback against things that work. They evidently work, but they're just not accepted in mainstream. And yet there are hundreds and thousands of people who have felt those effects themselves. And sure, it's anecdotal. Maybe there's not a peer-reviewed study behind each and every one of those stories, but if people are feeling better, then is there something wrong with the way they're being treated? I think that's the whole point, right? Is to help them feel better. So
yes, to fix them. They want to get out of pain. I never had a doctor call and yell at me for getting their patient better, ever.
Exactly. Yeah, I think that should be a good measurement, is how well are people feeling after they work with you and work with your treatments. So how does that change how they're experiencing pain and quality of life? So yeah, that makes a lot of sense to me, because I see that all the time. And very often, if we end up in a medical situation after an accident or an injury that is kind of the catalyst for our chronic pain, we're not told that there are other options. Mostly we just have medication, and then if we're lucky, we get physical therapy maybe, or chiropractor. That's it. That's sort of the limits of what there is available. So I find that so sad that we don't talk about all these other, like, such amazing approaches and techniques that are out there that can be so helpful.
And I think sometimes it's just lack of knowledge of the physicians. And the data actually shows that out of the 10 top reasons people go to see a doctor, 7 of them are because of pain.
Yeah, makes sense.
The top 3 has to do with updating a prescription, maybe a post-surgical visit or a checkup. But the other 7 reasons are all having to do with pain. And the sad part is only 7% of the time are they directed to physical therapy, which means 93% of the time they're given a pain med, they're sent to some type of a pain specialist, a neurologist, an orthopedist, or whomever. And that's crazy to me. There were so many people I saw after surgery that I really believe if I had been able to see them before surgery, we could have prevented the need for the surgery.
Yeah. Oh, I definitely believe that. And there are some studies, thankfully, available now that say that same things with back pain and different kinds of pains. So yeah, I feel that there's a gap there that you can fill with your presence and your information and insight and wisdom that will contribute to people's well-being. And as you said, not just talk at them, but really teach them how to do these things themselves. So when they have pain, they know what to do, which I think that's the most important part, is that we understand how to activate that inner healer that we all have and come back to wellness and well-being. Yeah, that's amazing. Now, I'm guessing that a lot of people who are in pain and who come to see you, and correct me if I'm wrong, but a lot of them who've not been exposed to any alternative things believe that the pain is physical and it's where it is, and that's why they're coming to see you. So I have shoulder pain, so Eileen, please fix my shoulder pain. And here I'm guessing there's a lot more to that than just that. So let us know, how do you view that? And how do you start exploring when someone comes to you as a client or a patient and they tell you, my shoulder hurts? Where do you start with that? And where does that usually take you? I'm very curious.
Yeah, so that's a great question. And of course, I could overwhelm someone giving them anatomy lessons and physiology lessons and biomechanics and physics, and we would never do that. You don't have to be a medical expert in order to understand how your body functions. It can be explained very simply. And very often I will explain how things are connected in a way that is impacting the body part that hurts. And so I will tell them, first, obviously, I'll assess the shoulder and see how it's functioning. And if there's certain movements that create pain, I know because of my experience that, oh, we need to look here. And almost always the shoulder is not the problem. And the issue is most people think the rotator cuff is the big deal. And that's sort of like nails on a chalkboard to me, because we always want to blame the rotator cuff. And everybody's out there with their TheraBand, pulling their hands apart, training that rotator cuff in external rotation. And it's probably one of I don't want to say one of the worst things we can do, but it can be absolutely useless, because I explain to people very simply, the rotator cuff is 4 muscles. It stabilizes the shoulder because it's a very unstable joint, because it's the most mobile joint in the body, so that you can swing that arm around and do pretty much anything you need to do with your arms. It's very mobile, which makes it prone to being unstable. So the rotator cuff's job is to stabilize the joint. The rotator cuff is not there for pushing, pulling, lifting, or any kind of power work. So we don't need to strengthen the rotator cuff. What we need to do is look at the other 14 muscles that directly impact the function of the shoulder. We also have to look at the pelvis, because the shoulder is working off that foundation. And depending on what the person is doing that creates the pain, we'll even look at their ankles. We'll look at the hips. And I'll explain that. I had a football quarterback come in, 22 years old, rock solid muscle from nose to toes. There was nothing wrong with his shoulder, but he was diagnosed with shoulder tendonitis, because when he did a 3-hour, 3-man throw practice, he had to stop early because of shoulder pain. I assessed his shoulder, nothing wrong with it whatsoever. I asked him to show me how he threw a football. And when he showed me, I saw that his ankle was very unstable. And I asked him, have you sprained that? And he said, I roll out on it during practice and I have to walk off the pain. So inside, I'm thinking, why is his coach and the trainer letting him play on such an unstable ankle? That was a whole side story that I couldn't get into. But we stabilized his ankle. 3, maybe 4 sessions. I know it was maybe 2 weeks. And his ankle was so much more stable because he was young, he was healthy, he was strong. So restoring that didn't take long at all. And he could throw that football for hours with no pain. I never touched his shoulder, but I looked at him as a whole person. I got the full story, and I understand how things are connected. Now, a lot of the times people, if anybody listening has ever been in a little fender bender, maybe sitting at a red light, get rear-ended, your foot's on the brake. So now that's going to cause this force to enter your pelvis, and you could end up with something called a torsion. Nobody's going to know to look for it unless they're trained to. It's not going to show up on an x-ray. Nothing's been fractured. But that torsion can throw things off enough where it pulls abnormally on a muscle that controls your arm motion. So now, every time you use your arm, the shoulder is not properly aligned because it's being pulled out of position. You could train the rotator cuff till the cows come home. It's not going to fix that. So you have to address the low back, correct the torsion, which is very gentle mobilization. It's a muscle energy technique that's osteopathic. It's been around for over 100 years, very safe, very gentle. And even if the person's wrong, they can't give you a dysfunction. They just won't fix it. So it's very safe. And I've corrected torsions and then done a special strain and counterstrain technique to calm down that muscle, the lat dorsi that's pulling. And voila, the person has full range of motion in their arm and no pain. Now, sometimes it takes a couple days for the pain to die down because of some inflammation and irritation that's occurred. But for the most part, the movement's restored. But it wasn't the shoulder that was the problem. So people need to know this. You need to be seen as a whole body because everything's connected. And the best part, Petra, is the fact that it doesn't take forever to assess somebody's whole body function. It's like a 20-minute thing. I can walk people through 6 movements that will show me 66 different joint motions and tell me what's wrong. And then the movements, they get combined. If you've got a problem in a hip and an ankle and a trunk, there's a lot of movements you can do that kind of fix all 3 things at the same time. So we're not talking 75 exercises. And it's so simple to learn. Yeah. You can hear my passion.
I'm picturing, as you're talking, picturing you moving people and just coming into alignment again. And I feel maybe people are also a little bit resistant because it's too simple, but that's all we need. Our body already knows how to be whole and how to be in alignment. Maybe we don't need so much extra stuff. We just need to get out of the way. Let it do its
Your
thing.
body just wants to give you a big hug and thank you for finally finding the culprit and stop beating up the victim.
Yeah.
Yes.
That makes so much sense. Eileen, is this something that people have to come see you for in person? Or can you also help people with chronic pain virtually? I want to say people that don't live near you. Is that a possibility? Or how do we work with that when we're not near a practitioner maybe who can help us with that?
Yes. So typically what I do private consulting, but it's all done online. I use Zoom. I've been doing it long before the world shut down, but now people know how to use Zoom, so it's a little bit easier. And I stopped working in a clinic setting over 5 years ago because I want to help more people. And I've learned that if I do a private consultation with someone and I think they need a local clinician that's trained in a certain technique just because of how they're presenting and their history and all, then I will recommend that. You need to find somebody local who does this, or this. But probably 95% of the time, we're able to fix things with the strategies that I teach them. And they don't need to see me personally. Also, I have online programs where not everybody wants to connect with somebody one-on-one. And of course, I have limited time that I can do that as well. And so I've got online programs where people can watch a 23-minute video and assess their own three-plane function, that 6 motions that I talked about. And they can see, oh my gosh, yeah, my ankle doesn't do this in that movement. Or yeah, my hip doesn't have that. And if you've got low back pain, it's almost always the hips below or the trunk above. If you have knee pain, it's almost always the ankles below or the hip above. If you've got shoulder pain, it's almost always the pelvis. Could be the ankles, depending on what you're doing. Could be the trunk. And if you've got neck pain, anything from the ground up could be off. I had a guy with chronic neck pain when he walked that we restored in one session by restoring ankle motion. Because when he walked, he had sprained his ankles so much in college, they weren't working properly. And he didn't know it. He didn't have any pain in his ankles, but his neck sure hurt him at the end of his walk and he had a headache. He was completely cured from that by restoring ankle function. And that only took one session. And he had had 8 or 9 sessions prior to that with conventional PT of hot packs, range of motion, ultrasound, which did nothing because his neck wasn't the culprit.
That's such a good point. As you're explaining that, I'm feeling pain in my ankle and my knees, and I'm like, oh wow, I have to go see Eileen. So I feel like our listeners probably are sitting in their cars or chairs or somewhere going, wow, yeah, my shoulder, yeah, oh yeah, I have a bit of a headache there. So now we know it's all connected, and certainly makes sense to treat the body as a whole because for everything's connected in the body, right? We have a skin around it that keeps it all together. So of course, everything will be connected to everything else. And yeah, it's a little bit simplistic to say like, oh, let's just look at the shoulder or just the elbow or something that is happening.
Yeah. It's kind of like the medical profession when they say we're only going to pay attention to the kidneys and we're only going to pay attention to the lungs. All those systems work together. None of those systems would work independently without the rest of the body.
Now, one thing that I'm very curious about is that I feel a lot of our pain has sometimes a lot more than a physical cause. So as you said in the beginning too, our emotions and our mental health, they all play into pain. We can often tell when we're not in a good state. We have maybe a pain flare up somewhere or we're feeling worse about the pain. The pain levels are higher. How do you integrate these other dimensions of chronic pain into your work, or do you? I'm very curious about that.
Yes. I go by instinct when I'm working with someone, or I will touch on these topics. Definitely. I've done 38 online events in the past 5 years that are all free on different topics. And I think it's important for people to understand that if you do have a past history of trauma, your body is going to be in a what I call run from the bear mode, because a lot of things will trigger you. You will feel unsafe and you won't know why. A trigger is when you respond abnormally to something that nobody else is responding to, like somebody tapping you on the back of the shoulder might just freak you out. So it's important to understand that if you have a past history of trauma and you have not healed from that, that is going to play a role, especially if you are experiencing chronic pain that you can't really resolve. And there's a scientific reason for that. It's not that the person is making it happen. We have this autonomic nervous system, and there's 2 aspects of that. There's the sympathetic, which is the run from the bear, keep me alive mode, fight, flight or freeze. And some people also use the word fawn. That's something new. And then there's the parasympathetic, which is the healing and repair mode. And that's when you digest your food as well. So if you're running from the bear, you're not healing, you're not repairing, and you're not digesting. It's not a good place to be. And the cortisol that gets released all the time is eating away at your short-term memory because it affects the hippocampus. It's depositing fat on your trunk. It does so many things to us. Cortisol is meant to keep us alive, like if we're a prisoner of war or we're during a famine. It's not meant to be released in our body day in and day out. It's a chemical cascade that occurs. There are strategies that you can use that I teach that will get people out of the run from the bear mode. Some of them is just simple breath work that can be very helpful at getting you into the heal and repair mode. There's some beautiful neurofascial work that I'll teach people using very specific things that will get them into the heal and repair mode. That's very, very important. Yes.
Yeah, I can see how that's a big component that sometimes might not even get noticed because we're so focused that our pain is physical. So there are a lot more things going on. And with the nervous
if you're running
system,
from the bear, those chemicals make all of your muscles tense to get you ready to fight. If you've got an area of the body that's already out of alignment, not working properly, it's going to hurt a lot more.
Yeah, that makes a lot of sense. People tell me that all the time. I'm so stressed and now I'm in pain and now it hurts worse. So yeah, or I'm so anxious. Now it's worse. Yeah, absolutely.
Yeah, they're not imagining it. They're not causing it to happen. Yeah.
That's fascinating. If our listeners are wondering a little bit now, okay, so where do we start with that? And maybe they've even been on their pain journey for a long time. I know there are a lot of people that have been through several doctors, pain clinics, and best they could do is take pain meds. What would you suggest to our listeners? Where can they start if they're finding that they aren't getting any answers or pain's not being resolved? And where can they start to help themselves a little bit on this journey?
I think one of the most important things is to see themselves as a whole body, understand that there may be some past things that are keeping them in stress mode. Learning some breath work, learning some ways to navigate that would be very important. In my YouTube channel, I've got hundreds and hundreds of videos where there's playlists and they can look this stuff up absolutely for free. Also doing the 3-plane assessment of the body, which, like I said earlier, is just a 23-minute video. And that's completely free also. And that's on my Move Without Pain website. And that Move Without Pain, it's mwpprivateclub.com. And they can do the free class. It also introduces them to 3-plane motion that will start to restore those rocks of the body that need to be working right for everything to be pain-free during our lifetime. And yeah, there's just a lot in there and it's absolutely free. And if they find that this really helps them and it resonates and they've got issues they want to further work, then there is paid level content, which is very affordable. They can learn to fix themselves. It's not that hard. It really isn't. It takes first rejecting the lie that nothing will help you. And if you feel like you've tried everything, that's not accurate because there's a lot of stuff out there and you'd have to be 1,000 years old to try everything. But I understand that they feel like they've tried everything based on the medical model. That's a whole different story. And if they've been told by a medical professional, there's nothing else we can do for you, or you're just going to have to learn to live with it, then reject that and seek truth. And I can tell you the number one thing I hear more often than not is people tell me, that makes sense. I am a whole body. When people hear truth, it resonates. And then they're all excited to, yes, let's do this. Yeah.
I think I have to tell you this funny story because this is exactly what you were just saying right now about us being whole bodies. I had an accident, and many listeners know that, about 6 years ago, and ended up in a wheelchair and did a lot of physical therapy and those kind of things. And one of the things that my practitioner asked me was to sit on the treatment table, close my eyes, and touch my finger to the side of my foot. So this is where I'd broken my foot. And I could not, for the life of me, touch my finger to my foot. I had no idea where it was. I was like, what is happening? Why can't I tell where my foot is? And that's what he was explaining, is that sometimes our brain will literally disconnect pieces of
Yes,
us
it
that
doesn't
are
want to receive the pain
experiencing
message.
pain. Yes. So I had to reteach my body that it is a whole and that this foot actually belongs to the rest of the body. It's fascinating that you say that, but this is how our bodies also protect us, right? They protect us from pain and sufferings. It is absolutely incredible what can happen when we restore all of these connections. Yeah, that made me feel very interesting, but happy to say my foot's back, reconnected.
Good.
So,
The brain knows where you are now.
yeah,
I actually have a video on my YouTube channel that says, does your brain know where you are?
that makes so much sense to me.
And people who have had total joint replacements, because that's a false joint, the brain
Right.
doesn't connect to that. It thinks there's no joint there. So it doesn't
Wow.
want you to step on that leg because it says there's nothing there. What are you doing? We can't stand there. So you have to retrain the brain when you have those kind of things too.
Yeah, you're right. That is starting to make so much sense. I also find that when we're dealing with chronic pain, very often it feels like we get a lot more clumsy. And I wonder if that's also the brain kind of just not knowing where we are in space with certain parts that are experiencing pain. Very interesting experiences that can all be addressed, all be reconnected.
Yes. Oh, yeah. And it really doesn't take long. There's one technique I teach, and I've taught it in classes also, where people start crying because they can't believe that they have no pain laying on their back after 10 minutes of doing these techniques. But you're basically reconnecting your brain to the rest of your body, and it doesn't take long. The body, as you've said a few times in this session, your body is so wise. It knows how to fix itself. It's just crying out for you to provide what's needed.
Yeah, absolutely. And it can be a life-changing experience, right? When all of a sudden you realize all the pieces are back together. It can be so impactful and life-changing, especially if you've made a lot of sacrifices and limitations because of your pain, or you've stopped doing activities that you love doing and really narrowed your life into a box that kind of fits the pain, right? It can be a life-changing experience to finally come back to that. So,
Yeah, the shrunken life so many people live because of pains is heart-wrenching.
yeah, absolutely. Now, I want to ask you before we wrap up, a lot of people say to me, okay, when you're younger, it's not normal to have pain, but as you get older, it's totally normal to have pain. Your body's falling apart. I always feel that's not really the truth. So what is your experience? Is there a point where we just shouldn't bother anymore, or can we help with our pain as long as we're alive?
Yes. So you are wise beyond your years because you are right. It is a lie from the pit of hell that we are meant to decline as we age. On a cellular level, biologically, the human body is not designed to decline. So why do we see it so much? And I tell people there's a difference between the words common and normal. Because we see something as common, like cardiovascular disease. Now, the actual definition of disease is abnormal functioning. So if someone has disease, it's abnormal. That's the definition. So why do we say it's normal to have these things as we age? Because we see it commonly. But just because something's common doesn't mean it's normal. And I can tell you, I have worked with populations in every age group for many years. I've been doing this over 30 years. I've worked with people over 100 years old and got them stronger doing squats. I remember one guy in his 80s who couldn't get out of a chair without help. And within 2 to 3 weeks, he was leg pressing over 200 pounds and getting out of the chair like a shot. And he was like 86. And he didn't want to exercise. He says, don't you think at my age I should be allowed to rest? Because his wife brought him into the clinic. And I said, well, if you want your wife to dust you off once a day. He wasn't quite sure he liked that answer. He was restored. The human body is designed to get stronger on a cellular level, no matter our age. And I know that's not the mainstream narrative that we get fed. The human body is not designed to have chronic pain because of age. The Stanford University School of Medicine did a study to determine the cause of joint damage, and it has nothing to do with age. It has nothing to do with gravity or wear and tear. It's chronic inflammation. And food is the biggest source of that. So food either promotes inflammation or fights inflammation. There's no neutral food. So it's important for people to know which foods to be feeding their body. And movement. If you're not moving properly, you're going to get wear and tear because bone is the slave of muscle. And if the muscles aren't moving the body correctly, the bones are going to end up abnormally aligned and abnormal wear and tear is going to happen. So I've worked with people who we no longer need disposable underwear because that, again, is muscle function. And it's not Kegels. That fails more often than not, which is why there's so many aisles of disposable underwear options in the stores. If it worked, nobody'd need that. And so there's so many things that we can do, fully clothed, upright, doing movements that are authentic in 3 planes that restore function. And it doesn't matter your age.
I want to leave our listeners with that because I feel like that is such an impactful thing that you just said. And yeah, we just take it for granted that we have to become old and decrepit. And it's good to know that we can actually do something about that, and we can do that at any time. So folks, if you're tuning in and listening and you have pain, which I imagine probably everybody listening to this podcast has pain somewhere, and give this some thought, give some thought to what you're doing, what you're not doing, and take advantage of Eileen's resources, connect with them, watch the videos, connect with her courses and programs. Because there are ways that we can help ourselves. There are ways that we can restore balance and wellness and our enjoyment of being on this planet, because that gets impacted so hugely when we have chronic pain that sometimes we just sit on the couch because there's nothing else that we can do that doesn't cause pain anymore. So yeah, we need to break out of these things and come back to our lives in a joyful way.
Yeah, one of the statements that I say is life is not meant to be endured. It's meant to be enjoyed.
Yeah, absolutely. And isn't that kind of the horrible thought that we all have, is that we're getting older and then we need somebody to take care of us because we're going to just have such a terrible life, and kind of thing is that to look forward to. So yes, we want to have the vitality, the health, and the enjoyment of our life fully. Mm-hmm. No disposable underwear.
Nobody ever set a goal to go to a nursing home.
No,
but it happens by default. And if they believe it's supposed to happen, they're not going to do what's necessary to keep it from happening. So the very first thing that's so important is to reject the lies.
Yep.
And know it's not true. That's critical, so that your mind will cooperate with you to do the things necessary to not have that happen.
Yeah, so there you have it. And we will be linking to all of Eileen's offerings in the show notes as well. So be sure to check there on how you can find the resources she mentioned, and also connect with her if you'd like to do some work yourself. And also, I feel that there are a lot of things that you have online that people can do on their own to further their health and their mobility as well. So start with that, dive in, and come into old age in a very sprightly way, because I think that'll bring us all a lot more joy and quality of life.
Mm-hmm. Absolutely. Yes.
Yeah. And thank you, Eileen, for being here today and sharing your wisdom with us. I feel this has been such an incredible episode, and I've learned so many things. So I hope that our listeners feel that same way and have a lot of things to take away now into their own lives so that they can make their lives better. Thank you for sharing that, and thank you for being here today.
Thank you for having me. It's been a pleasure.
Yeah, absolutely. And thank you for this amazing work that you do. And I want to say this courage to swim a little bit against the current to make sure that this comes out into the world and is seen. I want to say that because thank you for that.
Yeah, I've been prepped for this ever since I was little, because my mother used to always tell me, why do you always have to be different? And I think I was 40 when I realized it was good to be different.
Yeah. Absolutely, especially in this case. This is things that we need to hear, and everybody needs to hear that they have options, informed options that they can take. So absolutely, keep shining your light, and everybody, make sure you take advantage of these resources we've offered. And thanks for tuning in today. Take care, everyone, and be well. Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.